Hi, you are watching COVID updates on Voice of Canada, and this is Sana Haroon. Porter Airlines plans to resume flights starting September 8 to select Canadian destinations, including Toronto Island Airport, Ottawa, Montreal, and Thunder Bay, adding U.S. stops on September 17, marking an end to a dry spell of nearly a year and a half.
Porter plans to resume flying on September 8th to select Canadian destinations, including the Toronto Island Airport, Ottawa, Montreal, and Thunder Bay, adding U.S. stops September 17th, marking an end to a dry spell of nearly a year and a half. The company's plans to take to the skies have been pushed back 11 times during the pandemic, but the CEO is confident about the latest plan. There will be heightened safety measures, and that means extra training. The carrier has called back about 500 employees with plans to increase staff as flights are added. Dave Robson has worked for Porter for 8 years. He's looking forward to seeing his colleagues and passengers in person.
We've had a few changes in dates, and when I actually opened my email and saw that it's official, I was very excited and highly optimistic.
Starting this week, fully vaccinated Canadians and permanent residents who test negative for COVID don't have to quarantine for 14 days. This comes as restrictions ease across the country.
We've seen a very robust recovery in the U.S. Mexico's actually got a very robust recovery underway as well, which I think bodes well for a strong recovery for Canadian Airlines.
But we're not out of the woods yet. The Delta variant is still cause for concern. The border with the U.S. remains closed to non-essential travel. And although analysts predict a spike in demand as people rush to visit friends and family this summer, they see a dip in the fall as workers return to the office. Business travel isn't expected to bounce back until next year.
We've had an enormous response from passengers, that are excited to move again. Will we be back at 100% on day one? Absolutely not. But we do see a fairly, rapid recovery of traffic once it's safe to fly.
Community outreach teams, in conjunction with the City of Toronto, are getting ready to take to the streets to go door to door to find those who have yet to take the COVID-19 vaccine shot.
Herman Ellis knows this community inside and out.
Came to Canada at 7 and lived in Alexander Park ever since and worked in Alexander Park ever since. When are we going to be doing the next encampment run?
His community center is one of several mobilizing resources alongside the city to help people make decisions about COVID-19 vaccinations.
It brings the sort of less clinical angle to the pandemic and right to neighborhoods and right to your door, essentially, right?
The plan is to train up ambassadors who will then connect with people who still have yet to receive a COVID-19 shot.
We're simply saying, hi, I'm Representative Scanning-Cord. I'd like to talk to you about, vaccine. Did you get it or did you not get it? Or is there anything that you'd like to know?
The strategy has been at the ready in Toronto for some time. Roughly 77% of Torontonians have received a first dose. City and health officials always knew reaching the last percentage of individuals would be tough for a variety of reasons.
These could be people who have accessibility issues and are homebound because of that, people who have anxieties with needles, or people who are anxious about big spaces and anxious about getting vaccinated.
City officials say the detailed work in partnership with community groups will be key in getting more people to roll up their sleeves.
We're literally looking at what are the buildings, what are the streets, what are the sites where vaccine uptake is lower, and bringing vaccine through mobile clinics and community outreach right there.
While this approach can take time, some advocates are hoping the process picks up speed.
We need to be ramping this up, significantly in the next few weeks to ensure we're actually getting all the people that we've missed.
Because time is critical.
With Delta, 75% is not going to cut it for herd immunity. We need to be pushing this to as close to 100% as possible.
When countries around the world were sent into lockdowns in the first wave of the COVID-19 pandemic, experts warned of an impending mental health epidemic, anticipating rates of loneliness, suicide, and depression would skyrocket.
Jason Bradshaw says he loves teaching science in the classroom, and educating during the pandemic has taken a toll.
You feel like you're talking to a computer screen, and after several weeks of doing that, I think it really does start to get to you.
It's not only his mental health that suffered, he says, but his students as well. And while experts have warned of the havoc COVID-19, lockdowns, and fear would wreak on our psyche, a task force commissioned by the medical journal The Lancet instead uncovered a surprising shift.
Trends seem to show that by and large rates for psychological distress went up and then by and large went down.
Vancouver psychologist Lara Akkonen and her colleagues collected data from close to 1,000 studies across 100 countries. One poll in particular of more than 100,000 people worldwide revealed in 2020 most rated their lives on average as a 5.75 out of 10, the exact same score as previous years.
We aren't simply at the whim of viruses and any forthcoming natural disasters, but that we can mobilize, that humans can perhaps withstand these pretty drastic short-term alterations to our living styles.
But Akkonen says not everyone had the same experience. Individuals who faced financial hardships, contracted COVID, or those struggling with mental health disorders prior to the pandemic were more at risk. Harvard psychology professor Luana Marquez hopes to see a more in-depth study.
It's reminding us that it's not an all or nothing, and that perhaps the prediction of a tsunami may not be as large. I still think it's a little early to know long-term consequences.
Back in Brampton, as Ontario reopens, Bradshaw notes a positive change in his students and himself.
Ultimately, adaptation is part of the job when you're working with young people all the time.
Ontario reports 164 new COVID-19 cases, lowest seen since early September. Full Ontario reported 164 new cases of COVID-19 on Tuesday, marking the lowest count since September 9, and the second day in a row cases were below 200.
Hi everyone, thanks for joining. We're going to get started now. Just a reminder, we have approximately 30 minutes, one question, one follow-up. Today we have Dr. Moore here, so I'll turn it over to him for some brief remarks.
Good afternoon, everyone. Today there are 244 new cases of COVID-19 reported in Ontario. About 80 cases from 2020 have been included in Toronto Public Health's case count due to a data review. This means our daily number today is closer to 164 cases, which is the lowest we have seen since early September. We now have seen fewer than 300 daily new COVID-19 cases in the last 10 days. There are 202 people in hospital, 226 in the intensive care unit, and I'm sorry to report that there have been 9 more deaths from COVID-19. A total of 15,806 tests were processed yesterday with a positivity rate of 0.9%. So overall, the trends continue in the right direction in Ontario. There's every reason to be optimistic, but the Delta variant remains a difficult adversary. It's aggressive and it wants to spread rapidly. We have seen Delta's impact in the regions of Waterloo and Grey Bruce, but I am pleased to say that those communities have done a tremendous job in fighting back. In Waterloo, 80.6% of the population have had their first dose of a COVID-19 vaccine. That makes the first dose vaccination rate among the best in the province, and just over 43% have had their second dose. Grey Bruce is not far behind with 77.6% with one dose and 49.5% with 2 doses of the vaccine. I want to offer my thanks to everyone in those communities for their hard work in managing the recent surge in cases. You are to be commended, and to the people of Waterloo specifically. I know you are making sacrifices by decreasing your social contacts and sadly having to keep some businesses closed, but there is hope. Your sacrifices are helping all of Ontario, and we thank you. For Ontario vaccination data and rates, just like the residents of Waterloo and Grey Bruce, I would like to thank all Ontarians who have received their COVID-19 vaccine. We've done a tremendous job as a province, and thanks to the public health units, the pharmacists, the physicians, the nurses, primary care, we're doing a great job. Our current 7-day average for daily shots in the arms is close to 205,000 doses a day. And over 15.9 million doses of vaccine have been administered, with over 5.8 million Ontarians fully protected through 2 doses. It's truly remarkable what we've done in such a short time and what we can do as a province when we set our minds to it. I'm proud to live in a province where there's been such considerable uptake and enthusiasm for vaccines and prevention. But I just want to say time is of the essence. As our economy opens up and we once again visit our favorite restaurants, our stores and attractions, as well as visit each other, we must ensure that we are doing so safely, and that means not only to continue washing our hands, covering our coughs, wearing a face covering, staying home when sick, and getting tested if you have symptoms, but also we have to maintain a high level of immunization if we're going to beat this virus.
Next question.
From Mike Crawley at CBC News.
Hi, Dr. Moore. Wanted you to talk a little bit about the efforts that the province is going to put forward to actually reach out and get those people who have not been vaccinated and the children who are eligible that have not had a first dose yet. So what sort of efforts are we going to see from the province in doing that outreach? And in particular, what are you going to do to enlist family doctors in that effort?
Thanks very much for that question. So our local public health agencies across Ontario have been working diligently on trying to get that last 10-15% of individuals who may be hesitant to come forward and get immunized and or just don't have rapid access. So that partnership has to entail great relationships with local primary care and the local pharmacists. And we just recently received back feedback from all of our local public health agencies on how they're going to achieve that last 10-15% of immunization. So it's multimodal. Some of it will be walk-in clinics, some of it will be setting up those clinics outside of a day camp or outside of a setting where they've had a high risk of COVID-19 and working with all members of a community. So I've really been quite impressed by the multimodal methods that they're going to be using, including partnering with primary care. Primary care will be receiving lists of patients who have been immunized so that they can try to identify those that haven't and be able to reach out to those to be able to answer any questions that those individuals may have. And certainly we've been working with school boards as well to communicate back to families the need to be immunized to have the best and safest fall return of school. So I was very impressed with the plans that all of our local public health agencies have had and the partnerships with primary care that are building going into the fall to have the highest protection for all Ontarians that we can achieve.
Follow up.
On a separate topic, just wanted to ask you about outbreaks in long-term care. There have been 3 people that have died recently in these outbreaks, 2 of them in Waterloo Region and 1 in Burlington. How concerning are these outbreaks to you in long-term care, given that the vast bulk of people in long-term care ought to be vaccinated or are vaccinated, and what needs to be done to bring these under control?
Well, thanks for that question, and sorry to hear of the deaths in those settings. We've achieved a lot by having prioritized our long-term care patients and workers and families early on in this epidemic and have been able to decrease the death rate significantly. But sadly, no vaccine is 100% proof. And most in the face of Delta are around 90, 92, 94% protective against hospitalization and the ability to decrease the risk of death. But if you're frail and you're vulnerable, you may have still a risk of dying from this virus, even with 2 doses. So it tells us all that when we improve community immunity and we put rings of protection around vulnerable populations, we can protect them and protect ourselves. So we need to continue to embrace immunization by the workers, by the families, and protect those that are the most vulnerable to this virus. That is the way forward, as well as ongoing adherence to the best practices of infection prevention and control and screening. We can never let our guard down with this virus, as it just wants to continue to spread from person to person at a very rapid pace, especially this Delta variant. What is remarkable, though, despite the deaths, is that it was limited. When you have high immunization rates in those settings, the outbreak shouldn't be as severe and as catastrophic as what we've experienced in the first wave and second wave in Ontario. So the vaccines have a high protective rate. They are doing their job, but they're never 100%, and there will be an ongoing vulnerability, and it's every Ontarian's job to protect those that are vulnerable by getting the highest community immunity rate we can achieve.
Next question.
From Nicole Lampa at CTV News Kitchener.
Hi, Dr. Moore. Thanks for taking my question. You mentioned Waterloo, and our vaccine rates here in Waterloo region have improved. Our case counts have come down. However, we are still seeing continued outbreaks as well as elevated hospitalizations. I'm wondering if you can provide sort of a sweet spot in terms of the numbers and trends we need to see in order for Waterloo region to, go into step 2.
So that decision would be made by Waterloo Region, by the board and the Medical Officer of Health, and we're very happy to provide advice to them. I will say that they are working full out, that we're supporting them as best we can with additional nurses, additional vaccine, and they're doing the hard work that needs to get done to achieve such a high immunization rate. The current rate of illness today, we have 25 cases declared in Waterloo. It remains a very high-risk region in Ontario at 61 cases per 100,000 per week, but it's trending in the right direction. The thing is, with this virus, it is more transmissible, it is more aggressive, and it's harder to control. You just have to look around the globe that that's occurring. So you're heading in the right direction in Waterloo Region. And thank you for the sacrifices you've been making, again, for all Ontarians by trying to limit the spread of this virus. I do see light at the end of this tunnel as you build one of the highest immunization rates we can achieve. Just remembering that when you get up to 80% of your population, it still takes around 10 to 14 days to have the antibodies that are circulating that will protect individuals that just newly got immunized. But I do see, with that amount of vaccine and protection in the community, that your rates will be coming down, but it'll be hard work. And just have to thank the local public health agency and all health system partners in Waterloo Region that are doing such hard work day in, day out to protect your community.
Follow up, and this will be the last question.
My follow-up has to get back to the younger population and getting them vaccinated. If they're not at a level where you'd like to see come fall, I'm wondering if you will direct the Ministry of Education, perhaps, for the students and the families who did decide to get their children vaccinated, will you allow them perhaps to, continue on with sports teams and clubs, and would you require vaccination of students if they were to join such, teams come this September?
That's really, really good question. So we'll be working very closely with the Ministry of Education to have the protocols and policies for a safe reopening in the fall. I am optimistic that we can achieve, without any additional health policy, high levels of protection in high schools especially, given the age groups that are eligible right now. And we'll be working diligently with local public health agencies and the respective school boards to have the highest rates we can achieve. We'll be monitoring it to make any recommendations, whether there's immunization policies that should be put in play over the next month. But we haven't entertained that as of yet. So many Ontarians of that age group are stepping up and coming immunized that I am encouraged that we can achieve the rates we need, but we'll monitor the data very, very closely.
From viral vector vaccines like AstraZeneca to mRNA vaccines like Pfizer and Moderna, they all have the same goal to train your body how to fight off COVID-19, but they use different strategies to create antibodies.
All vaccines do the same thing. They deliver a tiny piece of the virus to train your body how to fight it. But there are different strategies to deliver that piece. Vaccines such as AstraZeneca are called viral vector vaccines. They use a crippled virus to deliver the coronavirus spike protein. It's called a hybrid virus because you take the virus that causes the cold and you put the gene of the coronavirus spike protein. Then there are mRNA vaccines such as Pfizer and Moderna. They use mRNA, the part of the coronavirus's genetic code, which creates its spike protein. Then they put that code inside a tiny fat pouch called nanolipid. Think of it like putting a message in a bottle. The recipients are your body's cells, responsible for printing the proteins your body needs to survive. The cells scan the instructions or code the vaccine carries and print proteins that look like COVID-19. These harmless proteins will teach our immune system how COVID looks like and will trigger the production of the antibodies needed to fight the virus. mRNA has a short shelf life. It disappears, but your immune system has a memory and will now know how to make antibodies.
Starting Monday, Canadians who are fully vaccinated against COVID-19 will no longer face mandatory quarantine when they arrive from overseas. Abigail Bimem looks at what this means for your summer vacation.
The Canada Border Services Agency is beefing up staff at crossings prepared for an influx of travelers when the rules change at 12:01 Monday morning.
There could be, some impacts to the time it takes across the border, and we'd invite people to be patient.
If you're a Canadian or otherwise exempt from restrictions and you're fully vaccinated by a Health Canada approved jab, you'll be able to skip the hotel quarantine and the full 14-day quarantine, as well as the day 8 test. You still need to provide proof of a negative PCR test and take another when you arrive. You have to enter the test result and proof of vaccination into a new version of the ArriveCan app, downloadable at 12:01 as well. Any unvaccinated children traveling with you still need to quarantine at home for 14 days, but can skip the hotel.
If you haven't been able to travel up until now and you weren't able to travel and enter Canada on July 4th, that doesn't change. On July 5th, those restrictions remain and you still can't come into Canada.
Mentally, it was affecting us mostly, the pandemic is being there on one layer and the other layer, not being able to reunite.
Bashir Amin is a Syrian refugee living in Montreal, a temporary resident ineligible for a visit by his partner of 5 years, Chloe Bordewick, in Boston.
I've been fully vaccinated for months. I'm ready to go, pick up any time now. Every month we've changed our plans again and again and again. It's disrupted our work, it's disrupted our mental health, it's disrupted, as I said, our ability to plan for a future together, and that's been really devastating.
Frustrated too that the original metric of 75% for a first dose and 20% for a second didn't move the needle.
If the goalposts continually move, faith in public health becomes eroded. And public health requires the trust of Canadians to be effective.
The prospect of having a bunch of people coming up to Pearson Airport, let's say in Toronto, and not having to quarantine, and then have Canadian citizens who are only singly vaccinated, because we're behind Americans on that, having to quarantine. And that just strikes me as politics and not science.
We will be looking at how this works before we open up to next step.
With the third wave of COVID-19 petering out in Canada, the narrative is shifting to positive milestones, like Nova Scotia poised to celebrate 1 million vaccine doses administered. But as provinces and the federal government make new rules for international travelers, there are new reminders of why some parts of the world are a long way from returning to normal. The World Health Organization's regional director for Europe says COVID-19 cases in the region are no longer dropping. He warns there will be yet another wave unless people stay disciplined and get vaccinated. About 63% of people in Europe have not had their first dose of vaccine.
Whilst we should all recognize the progress made across most countries in the region, we must also acknowledge that we are by no means out of danger.
Kluge warns an increase in socializing, travel, and large sports events could cause outbreaks of the fast-spreading Delta variant. Already, Russia is reporting its highest COVID numbers since January, more than 25,000 new cases on Sunday, driven by the Delta variant. There were 5 consecutive days of record-high deaths, including almost 700 on Saturday. Some countries are feeling more confident. In the United Kingdom, the Wimbledon tennis tournament will allow maximum capacity crowds from the quarterfinals onward. The UK government is planning to ease pandemic restrictions on July 19th. By contrast, people in Brazil took to the streets in the thousands, demanding the resignation of President Jair Bolsonaro. They accused Bolsonaro of mismanaging the pandemic, allowing COVID-19 to run rampant and kill more than 500,000 people. Scenes that seem to validate Canada's regulated approach to COVID-19 and step-by-step reopening.
If you have been vaccinated against the coronavirus, you probably received a celebrity at Got My COVID-19 vaccine sticker or posted a picture on social media marking the momentous occasion.
When Mark W. Gray put his COVID-19 fully vaccinated pin online, he had no idea it would sell like gangbusters.
Etsy shut my store down after a week because I was selling really fast.
So fast, he made $9,000 in a matter of days, he says.
There's been days when it's just surged like crazy and I've sold like 1,000 pins in a day.
Pins, patches, stickers, t-shirts, water bottles. There's no shortage of vaccination status swag. Stateside, there's now a bracelet, the Immuniband, which links a QR code to one's vaccination card.
It's a matter of saying, I belong in this community.
Vish Viswanath, the professor of health communications at Harvard University, says all these wearables can serve an important public health message, normalizing getting vaccinated.
They are seeing other people getting vaccinated and feeling a sense of pride about it, sort of provides that acceptance.
Communications expert Susan Kren agrees, but cautions it won't work for everyone, including those who don't want to share their medical information.
It can create that kind of, animosity or sense of division again when really we need people to be able to kind of communicate.
Business owner Matt Stream says he's creating these masks and pins to help avoid potentially awkward conversations.
If they were sitting on a plane next to somebody who was wearing a vaccinated pin or a recovered and cleared pin, that they would feel better.
Gray says the mad dash to deck oneself out with a shot status is simply human nature.
Because we are social creatures. People want to do what everyone else is doing.
A pandemic trend he doesn't expect will last as the world reopens.
Hundreds of thousands of Canadians are getting vaccinated on a daily basis as COVID-19 vaccine does continue to roll out, with the country already having about 30% of the eligible population aged 12 and older fully vaccinated.
As part of a study out of Sinai Health, Amanda Ferguson has been monitoring her COVID-19 antibody levels post-vaccine.
Because I have a compromised immune system, I wanted that sign that my body and my immune system was working. And other than a little bit of fatigue, I didn't really feel much.
Living with Crohn's, that lack of symptoms after her first Pfizer shot had her worried she wasn't protected. Thankfully, her results provided good news.
16 days roughly past the first shot, then you saw, oh my gosh, I'm protected, and that it was such a relief.
Doctors say normal reactions to a COVID-19 vaccine range from a little bit of soreness at the injection site to muscle aches, headaches, and fever. For those lucky enough to have no symptoms, experts say there isn't cause for concern.
We're all a little different, and all our immune responses are a little different, and we all have different sensitivities to the response.
And while Earl Brown, a professor of virology at the University of Ottawa, agrees, he notes immunity is linked to inflammation.
You need a certain amount of it. You don't need enough to make you sick, and so you're not necessarily more immune if you're put in bed for a day.
Brown also points out different vaccines can prompt different reactions. He says mRNA vaccines, for example, haven't been used in the past because they cause too much inflammation. That's been modified in the Moderna and Pfizer COVID-19 vaccines.
It is a dance when you're vaccinating. Getting a vaccine will stimulate the immune response sufficiently, but not excessively.
For Ferguson, her second Pfizer vaccine left her with just a sore arm, she says. Again, she anxiously awaited her antibody levels.
The results came back loud and clear that not only I had a good amount after the first shot, but then I had a really good number after the second. That should give all healthy Canadians some peace of mind.
Peace of mind and confidence.
There's a good news for thousands looking to travel in the European Union as a bloc looks to roll out a new COVID-19 vaccine passport system.
The European Union is gradually rolling out its digital COVID certificate. The programme will allow EU residents who've had COVID-19 or who provide a negative test to travel more easily. The same will apply to the fully vaccinated. If and when the EU expands those rules to non-residents, it could be good news for Canadian visitors. Brussels has approved the same 4 vaccines as Ottawa. However, the EU has not authorised the Indian-made Covishield version of AstraZeneca, only the European-made one. In Canada, 272,000 people have received at least 1 dose of Covishield, compared with 1.6 million Canadians who have had the European-made AstraZeneca.
My understanding is that the 2 AstraZeneca manufactured vaccines, European Union and Indian, are biologically identical. So what we've got is a bureaucratic situation here that could well indeed stand in the way of people's freedom of travel.
The European Medicines Agency says the maker of Covishield, the Serum Institute of India, hasn't applied for authorization in Europe.
You do have to go through this very rigorous quality control process where you are assured that the same process was used and that the vaccine that you have at the end of your process is as good as the one that's coming from another plant that's already authorized.
The disconnect highlights a broader issue. Hundreds of millions in the developing world are getting shots not approved in the West.
I think what we need to do is the world needs to get together and they need to have a list of vaccines that are approved across the standard.
The EU says its individual member countries can also decide to accept travellers vaccinated with WHO-approved shots. Ottawa says it's in talks with the G7 and the WHO on the issue.
Keep watching COVID updates on Voice of Canada. For further updates, visit our website voiceofcanada.tv.